Hello, my name is Dr. Dewan S. Raja. Today I will discuss about congenital dislocation of the hip joint. Congenital hip dislocation, often called developmental dysplasia or dislocation of the hip, occurs when the head of the femur is out of the hip joint, that is dislocated, or is not stable in the hip joint at birth. It involves abnormal development of the hip socket, the acetabulum, and or the ball of the hip joint, femoral head, leading to instability or dislocation of the hip joint. Having hip dysplasia can also cause looser than usual muscles and ligaments around the hip. And at birth, the fibrous capsule of the hip joint is weaker than that of the adult, and it is also looser than that of an adult. Approximately 1.5 parts 1000 live birth. This is the incidence. Boy to girl ratio is 1:8, so girl has 8 times more possibility to get congenital dislocation of the hip joint. Okay, so this is the acetabulum, this is the head of the femur, this is the ball, this is the socket. So this is a ball and socket joint, the hip joint. So the head should be in the socket of acetabulum, supported by the ligaments, and it should not be out of this socket. If it is relaxed, loose, or out of the socket, we call it congenital dislocation of the hip joint. It is congenital because it develops in the infancy. It develops during the intrauterine life, so it is congenital. Dislocation of the hip joint in adult may be possible due to accident. Okay, to diagnose the congenital dislocation of the hip joint. Okay, so we have two tests. One is Barlow Test, another is Ortolani Test. In the patient, the child or infant is in supine position. The hip is flexed, knee is also flexed partly. Okay, then the examiner put the thumb on the medial aspect, the upper part of the thigh, and push it back. So it should be, in this case, it may go back, so there will be dislocation. Okay, so again the examiner put the hand on the trochanteric area and push the thigh anteriorly. Okay, that is the Ortolani test. The dislocated head of the femur should come back to the socket, to the acetabular socket, and will get click sound in both cases, when coming out or going back. So if this is the condition, then there is congenital dislocation of the hip joint. We have two tests. One is Barlow test, another is Ortolani test. What are the causes of congenital dislocation of the hip joint? The exact cause is not always clear, but it can be influenced by genetic factor, breast presentation. Normal presentation is cephalic, breast presentation is abnormal. So the buttock comes first through the birth canal in breast presentation, and these babies are more prone to develop congenital dislocation of the hip joint. So we have environmental factor may also contribute in the congenital dislocation of the hip joint. Symptoms in infants. Symptoms may not be obvious early on. As the child grows, signs can include limited movement in one leg, inability to abduct the thigh, asymmetrical thigh or gluteal folds, and uneven leg length. So two of the lower limb are not same length because due to dislocation of the head of the femur, so the limb seems to be shorter in the affected side. It may be bilateral, that is also possible. Congenital dislocation of the hip. It may be unilateral, it may be bilateral. Okay. Most commonly it is unilateral, but it may be bilateral too. Okay. So diagnosis, we have another test, positive Trendelenburg sign. One of the limb will sagging down, okay, in standing position. Diagnosis, newborn are routinely screened for hip instability using physical examination technique like Barlow and Ortolani maneuver. Ultrasound or X-ray imaging may also be used for diagnosis. Treatment depends on the severity and age and diagnosis. For infants, methods such as pelvic harness, a special harness that helps position the hip correctly, or other orthotic devices may be used. So, pelvic harness. In older infant or children, surgery may be necessary to reposition the hip joint. Prognosis, early diagnosis and treatment generally lead to better outcomes. If left untreated, congenital hip dislocation can result in hip dysplasia, pain, limping, and early arthritis in adulthood. Arthritis means pain in the joint. Okay. Prevention, proper screening during infancy, especially for babies born in breech presentation, and early intervention are crucial for preventing long-term complications. Congenital dislocation of the hip joint requires prompt attention to prevent lasting hip joint problems. Regular checkup with pediatrician and orthopedic specialist are essential for early detection and management. And that's all about congenital dislocation of the hip joint. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.